So you get that vet report back. Maybe it was just, routine x-rays, or perhaps you notice your pet seemed a little stiff, maybe a bit slower getting up lately. And then you see it, Spondylosis Deformans, that name.
It sounds, well, pretty dramatic, doesn't it? Kind of intimidating.
Yeah, it does have that ring to it.
Well, today we're going to really cut through that and dig deep into the source material you've given us. Our mission here is to unpack exactly what spondylosis deformans is, what it actually means for your dog or cat, and crucially, why for a lot of pets it's really not as scary as it sounds initially.
Right, that's a key takeaway.
Okay, so let's just dive right in. At its very core, what is spondylosis deformans?
Okay, so based on the research we looked at, it's basically a degenerative process, happens in the spine, it's considered non-inflammatory, and the defining feature really is the growth of osteophytes.
Osteophytes?
Yeah, think of them like bony spurs. Or sometimes they form little bridges along the edges of the vertebrae, usually right near where the infravertebral discs attach. Got it. Bony spurs, little bridges. So where do these usually pop up along the spine? Are there, hot spots?
There are, yeah. The sources point to some common areas, although technically it can happen anywhere. In dogs, you often see it in the thoracolumbar spine. That's sort of the mid to lower back area, especially right around where the ribs end and the lumbar spine starts.
Okay.
And also the very end of the spine, the lumbosacral area, L7S1, right near the pelvis. That's a really common spot in dogs, too, probably because there's just a lot of biomechanical stress there.
Makes sense.
Now, in cats, interestingly, it seems a bit more common higher up in the thoracic vertebrae, the mid-back. And while you can see it in the neck, the cervical spine, in both dogs and cats, that seems to be less frequent overall.
Okay. And who's most likely to develop these spurs? Is it just an old pet thing, or can younger animals get it?
It is definitely strongly linked with age. The chances go way up as they get older. For dogs, the stats we saw suggest maybe 50% have some signs of it by age 6. Yeah, and it jumped to something like 75% by the time they're 9. So, yeah, incredibly common in seniors.
Okay.
But that said, the sources do mention it can be found in younger dogs. Sometimes there's a genetic predisposition involved.
Genetics. Are certain breeds more prone?
Yeah, they list several. It seems common in larger breeds, German Shepherds, Boxers, Airedales, even Cocker Spaniels. Also mentions Labradors, Goldens, and interestingly, brachycephalic breeds too, the short-nosed ones like Bulldogs.
Right.
And for cats, there was a note about a possible sex difference. Maybe females more than males, though that might need more research. And there was a really fascinating point about Boxers, a strong genetic link found between spondylosis and hip dysplasia.
Really?
Yeah, and apparently you can sometimes spot signs of both on x-rays as early as 1 year old in those predisposed lines.
That's interesting. Okay, now here's where it gets, really interesting for owners and often causes that initial panic because a lot of the time you don't even know it's there until you see it on an x-ray, right?
Absolutely. That's probably one of the most crucial points the sources emphasize. Patients are typically asymptomatic.
Meaning no signs at all.
Pretty much.
Yeah.
It's very often described as having minor, if any, clinical importance. Like one statistic mentioned was it's found in 68% of asymptomatic domestic cats.
68%?
Yeah. So for tons of pets, these bony changes are just an incidental finding. They're taking x-rays for something totally unrelated, maybe a checkup or a cough or looking for arthritis in the legs.
And they just happen to see it.
Exactly. It's just there on the film.
Okay, wow. So maybe the biggest takeaway right there is seeing spondylosis on a report does not automatically mean your pet is in pain or has a major problem. That's huge for owner anxiety.
Definitely huge.
Okay, but if it does cause signs, what would those be? When should someone actually worry?
Right. So if signs are present, the most common thing reported is localized spinal pain.
Okay. How does that look?
It might show up as stiffness. Maybe they don't move their back as freely, or they're hesitant to do things they used to do.
Like jumping.
Exactly. Reluctance to jump up, maybe avoiding stairs, less enthusiastic about exercise. The pain might seem worse when they move, and it could be a chronic, low-level thing, or might flare up now and then.
Okay.
The research suggests this pain is often linked to the active formation of those osteophytes, like while they're actively growing, or if that part of the spine stays unstable.
So the process of forming them can hurt.
It seems so. And another specific cause of pain mentioned is if one of those bony spurs or bridges actually fractures. That could definitely cause sudden pain.
Ouch.
You might also see changes in posture, like maybe a slightly hunched back, or they hold their head a bit lower.
Okay, what about nerve problems? Weakness, wobbliness?
That's another key point. Neurological deficit, so problems with walking, coordination, Weakness directly caused by the spondylosis spurs pressing on the spinal cord or the nerves. That's described as unusual.
Unusual, okay. Not impossible, but not typical.
Exactly. It can happen, but it's not the standard presentation.
So if you do see neurological signs, what's usually going on then?
Well, when you see signs, especially neurological ones, the sources point to a few possibilities. One is that instability and pain during the active bone-forming phase we just talked about. Another is nerve root impingement. That's where a growing spur actually presses on a nerve right where it exits the spine.
Okay.
That can cause something called radiculopathy pain, maybe lameness, even muscle wasting, but specifically in the area that nerve supplies.
Right, like down a leg or something.
Yeah. So if it's happening low down in the back, the lumbosacral area, it could potentially affect the sciatic nerve, causing hind limb issues. Or it could contribute to signs of cauda equina syndrome that affects the nerves at the very end of the spinal cord, leading to hind limb weakness, maybe trouble with bladder or bowel control.
Okay, so that's a possibility.
It is. But, and this is really, really important from the material, spondylosis very often exists alongside or maybe even happens because of other spinal problems.
Like what?
Things like degenerative disc disease, DDD, or intervertebral disc disease, IVDD, where the disc itself is bulging or herniated and causing the compression. Or maybe vertebral malformations, or even neck issues like wobbler syndrome.
Ah, so the spondylosis is there, but it's not the main villain.
Often, yes. In those situations, the clinical signs you're seeing, the pain, the neurological problems, are frequently primarily caused by these other issues pressing on the cord or nerves, not the spondylosis spurs themselves.
That makes a huge difference in how you'd approach it.
Absolutely. It means just seeing spondylosis on an x-ray doesn't tell the whole story if there are significant signs. You have to figure out the real source of the problem.
Okay, that's clear. So we've got a good handle on what it is, what it might look like or often doesn't look like, but why? Why does this whole process even start? What triggers these spurs?
Well, the sources list a few potential contributing factors. Things like repeated minor stress or microtrauma to the spine over
Wear and tear.
Kind of, yeah. Or maybe a single major trauma. We mentioned the inherited predisposition. And even certain hormonal conditions like acromegaly. But the main thinking, the primary theory, is that it's the body's reaction to chronic instability or degeneration, especially involving the intervertebral disc and the ligaments holding the spine together.
So the spine feels unstable.
Right. As a disc ages or gets damaged, maybe it loses some cushion or allows too much movement between the vertebrae. The body senses this abnormal motion, this instability, as a problem. And its natural response is to try and stabilize it.
How? By building bone.
Exactly. It lays down new bone, those osteophytes, starting from tiny fibers called Sharpie's fibers that anchor ligaments and the disc to the bone. These spurs grow outwards, trying to bridge the gap, essentially building a natural brace to stop the unwanted movement.
Wow. So the body's trying to fix it.
It is. It's an attempt at stabilization, even though that process itself, or the spur it creates, can sometimes cause secondary issues.
That is fascinating. Okay, so how do vets actually diagnose this then? Sounds like imaging is crucial, especially x-rays.
Yeah, imaging is definitely key, but it starts with a really good clinical examination.
Why is that so important?
Because you need to carefully assess if there are signs like pain or neurological deficits. And you also need to try and pinpoint where the problem is. Is it really the spine? Or could it be pain from the hips or knees, which can sometimes look similar?
Good point.
But then, yes, the main tool for actually seeing the spondylosis itself is spinal radiography, just plain x-rays.
And what do they show?
They show those classic bony spurs coming off the edges of the vertebral bodies. They might start small, look like little triangles, and then grow larger, sometimes looking like they're reaching across the space to the next vertebra. Though the sources mention that getting a complete solid bony bridge, true fusion, is actually pretty rare.
Okay, but x-rays have limits, right? You said they don't show nerves well.
Exactly. That's a critical limitation. X-rays mostly just show bone. So if a pet comes in with neurological signs like weakness or wobbliness, the x-ray might show spondylosis, but it cannot definitively prove that the spondylosis is causing those signs.
Because something else could be pressing on the nerves.
Precisely. You can't see the spinal cord or the nerves clearly on a standard x-ray.
So that's when you need more advanced imaging.
Yes, but typically only if there are neurological signs or if there's significant pain that isn't getting better with standard treatment. CT scans are great for getting really detailed pictures of the bones. You can see the spurs, the little facet joints, any bony pinching very clearly.
Okay.
But MRI is generally considered the gold standard when you suspect nerve or spinal cord issues because it shows the soft tissues, the discs, the spinal cord itself, the nerve roots in much better detail.
So MRI is key if there are neurosigns.
Absolutely essential, really, to figure out if the problem is actually a bulging disc or maybe a tumor or some other soft tissue thing causing the compression, which, as we said, is often the case when you see neurological problems.
Got it. What about myelography?
That's an older technique. It involves injecting dye around the spinal cord to make it show up on X-rays or CT. It's more invasive, carries more risks, and generally isn't used as much now that MRI is more widely available.
Right. And since the signs, when they are there, can mimic other things, you obviously have to rule those out too. What else is on that list?
Yeah, the differential diagnosis list is important. If you've got back pain or neurological signs, the vet needs to consider other potential causes. Big one is intervertebral disc disease, IVDD. Very common. Often causes sudden severe pain and nerve problems because the disc material pushes on the spinal cord.
Okay.
Then there's degenerative myelopathy, or DM. That's a progressive nerve disease, usually in older, large dogs. Causes hind limb weakness without pain. Different process, though it can sometimes exist alongside spondylosis.
Right.
Obvious things like vertebral fractures or dislocations, usually from trauma. Spinal tumors, either starting there or spread from elsewhere. Discospondylitis, that's an infection of the disc and bone. Causes severe pain and looks different on x-rays. You see bone destruction, not spurs. Also, facet joint osteoarthritis, arthritis in the small joints connecting the vertebrae, different from the spurs on the main body. And lumbosacral stenosis, narrowing in the low back canal, often caused by a mix of things, including disc issues, ligament thickening, and sometimes spondylosis contributing too.
So lots to consider to make sure you're treating the right thing.
Exactly. Ruling these out, or identifying them if they're present, is crucial before you can say the signs are definitely due to the spondylosis itself.
Okay. So let's say you've gone through all that. The diagnosis is made, maybe it's just incidental spondylosis, or maybe there's some mild pain linked to it. What's the treatment plan look like? Can you get rid of the spurs?
Yeah, that's the thing. There's no treatment or surgery that makes the spondylosis spurs themselves go away. It's not like you could just chip them off. So the focus is entirely on managing any symptoms, mostly pain if it's present, and just maintaining the best possible quality of life for the pet.
No cure, just management.
Pretty much. And the sources are clear. Surgery is very, very rarely needed or helpful for spondylosis itself.
So mostly conservative management then. What does that involve?
Yes, conservative management is absolutely the main approach. First thing, often, is weight management.
Makes sense. Less load on the spine.
Exactly. Especially crucial if the animal is overweight. Then, activity modification.
Meaning?
Avoiding high-impact stuff, like no intense fetch sessions, maybe limiting jumping on and off furniture, avoiding rough housing that twists the back. But controlled exercise, like regular leash walks, is usually good to keep muscles strong.
Okay. What about medications for pain?
Yeah, if there's pain, meds are key. NSAIDs, non-steroidal anti-inflammatory drugs, are usually the first choice. Things like carprofen, meloxicam, daracoxib, ferrocoxib for dogs.
You hear those names a lot.
You do. They help with pain and inflammation. Of course, you have to be careful with long-term use, monitor kidney and liver function, watch for stomach upset.
Right.
And it's important to remember, NSAIDs and definitely acetaminophen, Tylenol, are generally not safe for cats. They need different pain strategies.
Good point about cats.
Yeah. For dogs with sensitive stomachs on NSAIDs, vets might add antacids or stomach protectants.
What about other pain meds besides NSAIDs?
Yes, there are others, sometimes used alongside NSAIDs to maybe lower the dose or for different types of pain. Gabapentin is common, especially if nerve pain is suspected. Tramadol is used, though its effectiveness in dogs is debated sometimes, but it is used in cats. Buprenorphine is a potent opioid-like drug, often good for cats.
Okay.
And if there are muscle spasms around the painful area, a muscle relaxant like methocarbamol might be prescribed.
What about supplements? Glucosamine, fish oil?
They're mentioned a lot. Glucosamine, chondroitin sulfate, omega-3 fatty acids. The idea is they support overall joint health, might help reduce inflammation. They won't reverse the spondylosis, but they're often recommended as part of the overall supportive plan.
And physical therapy.
Definitely. Physical rehabilitation can be really beneficial. Therapeutic exercises can strengthen the core muscles supporting the spine, improve flexibility. Modalities like laser therapy, acupuncture, massage, even hydrotherapy like walking on an underwater treadmill can help reduce pain, improve mobility, and keep muscle mass up without stressing the spine too much.
Sounds like a comprehensive approach. Now, surgery, you said it's rare just for spondylosis. When would it be considered?
Right, very rare for the spondylosis alone. Surgery would really only be on the table in pretty specific, uncommon situations, like if the bony spurs were definitively causing significant compression of a nerve or the spinal cord, and that was causing severe signs that just weren't responding to all the conservative management we talked about.
Okay, so a last resort kind of thing.
Pretty much. More often, if surgery is done on an animal that also has spondylosis, it's usually to address a concurrent problem, like a bad disc herniation, IVDD, or a severe compression in the cauda-equina area that needs surgical decompression removing bone or disc material to relieve the pressure on the nerves.
So the surgery fixes the other problem, not the spondylosis spur itself.
Exactly. The goal is to fix the main source of the compression. Things like stem cell therapy or PRP are mentioned as emerging or investigational, but not standard care for spondylosis right now.
Okay. So putting this all together, what's the general outlook? What can owners typically expect long term?
It really depends on whether the pet has symptoms and how bad they are. For the majority of pets, the ones who are asymptomatic, where it's just found incidentally the prognosis is excellent, it usually doesn't impact their lifespan or quality of life at all.
That's reassuring.
It is. Now, if the pet is symptomatic but only experiencing pain, the prognosis is still generally good with that conservative management approach. The pain is often manageable. And interestingly, sometimes if those spurs eventually form a solid bridge, it might actually stabilize that spinal segment, and the pain related to the instability could potentially lessen or resolve.
Oh, interesting.
But if the animal has spondylosis and neurological signs, then the prognosis is more guarded, maybe fair to good. It really depends on how severe the neurological issues are, what the actual underlying cause of the nerve compression is. Remember, often it's that concurrent disc issue, and how successful any necessary surgery is.
Okay, that makes sense. Is there anything people can do to prevent it?
Prevention is tough because it's so tied to aging and degeneration. The main preventative strategy discussed in the sources is really about genetics in those predisposed breeds, like boxers.
So responsible breeding?
Basically, yeah. Selective breeding to try and reduce the incidence. That early screening with x-rays around 1 year old in those breeds can help identify affected dogs for breeding decisions. Beyond that, maintaining a healthy weight throughout life and maybe avoiding excessive high-impact activities might theoretically help reduce stress on the spine, but it's often just seen as a very common part of the aging process for many dogs and cats.
Right. So when an owner hears spondylosis deformans from their vet, what are the absolute key takeaways they should hold on to?
Okay, I think the biggest things for owners to understand are, 1, it's a degenerative change, often related to age, and very, very often it's harmless, just an incidental finding on an x-ray. Don't panic just based on the name.
Right. Number 1, don't panic.
Exactly. 2, if there are signs, the main approach is conservative management, focusing on weight, appropriate activity, pain meds if needed, maybe physical therapy. 3, it's generally a chronic condition, doesn't go away, but any associated pain is usually manageable. 4, keep an eye on your pet watch for any changes in their comfort, stiffness, or mobility, and report them to your vet.
Okay.
5, be reassured that if a thorough workup was done, especially if there were concerning signs, other more serious conditions have likely been considered or ruled out. And finally, the focus should always be on maintaining their quality of life. Maybe suggest simple things at home like ramps, good bedding, non-slip mats.
That's a great summary. So really putting it all together. This deep dive highlights that spondylosis deformans is often the body's own sort of natural attempt to fix a problem, right? That instability in the spine from aging or wear.
Yeah, that's the fascinating part. The body's protective response, building that extra bone to try and stabilize things, can sometimes, paradoxically, cause its own issues during formation, or maybe more often it just happens to be there alongside the real problem, like a disc issue that's causing the actual symptoms.
And for you, the listener, understanding this framework really helps you interpret what your vet tells you, right? You can ask better questions, especially if your pet does have symptoms like, are we sure it's the spondylosis causing this, or is something else going on?
Exactly.
And it helps manage expectations. It's often not this big, scary disease the name might suggest.
Which leads to kind of an interesting thought. Given that the body's trying to stabilize a degenerating area with these spurs, and yet symptoms can still pop up, either from the spurs themselves sometimes, or more often from those associated conditions like DDD.
Yeah, so the provocative thought maybe to leave you with is this. How do we best support the body's natural attempts at repair, like the stabilization effort, without causing other problems? And where do we draw the line between just accepting a normal, non-painful aging change, like asymptomatic spondylosis, versus stepping in to actively manage things when that change, or something happening alongside it, does start causing pain or impacting quality of life?
Hmm. That's a good one to ponder. It's about balance.
It is. Well, thank you for joining us on this deep dive into spondylosis deformans. We really hope unpacking this helps you navigate this common finding with a bit more clarity and maybe a little less worry.